So the most common injuries we will see in the office are the ones that occur as part of play or part of some sporting event. And they're the ones that quite often seem much less than they might be, that something hurts and it's just not getting better at the rate that you might think. Quite often we see it's by the way the children land, the most common injuries are going to be to the wrist or to the ankle. If they put their hands out to brace themselves after they're falling, you're going to find mostly the injury to the wrist. If they step in a hole or twist their ankle or take an awkward move, quite often it is going to be the ankle that's injured. When do I need to come to the doctor? When do I need urgent care? When the pediatrician? When the emergency room? At what point do I know? And it's a very difficult question to answer because each child reacts differently to each injury. So typically, if something just doesn't seem right would be the answer. If the child is comfortable, then it might be more reasonable to wait to see what comes of it. But if the child is uncomfortable, or if it just doesn't seem like it's your typical response to an injury, then the next step needs to be taken. If it still doesn't feel right, the next step would be to come see us. We truly are one-stop shopping for any type of injury. We have the capacity here to take our own x-rays and read our own x-rays and be able to treat immediately based on our interpretation and our years of experience of looking at x-rays and knowing what to look for in terms of fracture, having both the patient and the x-ray available to us, and any type of treatment that might be necessary, casting, bracing, whatever is necessary, we have here. So coming to see us for these injuries will end up with a complete care. I get asked quite often, how is this child's third fracture or even fourth fracture? What is wrong with my child's bone? And the answer is almost uniformly nothing. The child is being a child, but there's risk from anything. Just walking down the block presents risk. So I would encourage all families to have their children involved in events, but to be smart about how they play, that they should be playing to their age level. For example, the trampoline, it's fun and it's okay, but one at a time. That's the safe way. And these are the sort of the seemingly simple and obvious things that children don't know from serious and obvious, and they'd rather have fun.